Nurse saves veteran's life, then loses her job. Minutes later, the director arrives. The emergency room was chaos, as always. Nurses rushed between patients, doctors shouted orders, and machines beeped urgently. But for Emma Carter, none of it faded her focus. She had always known she was meant to be a nurse. She wasn't in it for the paycheck or the long hours. She was in it for the people, the hands she held, the lives she saved, and the moments that mattered. That night, she was just about to finish her shift when the doors burst open. Paramedics wheeled in an elderly man, his face pale, his breathing labored. James Porter, 76, U.S. Marine Corps, retired. The words were stitched onto his faded military jacket. Respiratory distress, low BP, history of heart failure, the paramedic called. Emma's heart clenched. She rushed to his side. His eyes flickered open for a moment, full of fear and pain. I can't breathe, he gasped. His hands were trembling, reaching for something, or someone. Without hesitation, Emma grasped his hand. "You're not alone, sir. I've got you," she said, squeezing gently. The doctors hesitated. The protocol for a patient like this required approval from the attending physician, who was nowhere to be found. They needed to wait. But James didn't have time. Emma knew what needed to be done. Every second mattered. She grabbed the nearest syringe and administered the emergency medication that could open his airways. Then, she carefully adjusted his oxygen levels, monitoring him with precision. Within seconds, his chest rose more evenly. His color returned. His grip on her hand tightened, not in panic, but in relief. A minute later, his breathing stabilized. The crisis had passed. The room sighed in collective relief. But before Emma could feel the victory, a cold voice cut through the air. "Nurse Carter. My office. Now." Emma turned to see Linda Reynolds, the hospital's chief administrator, a woman more concerned with rules than lives. Heart still racing, Emma followed her into the office. "You directly violated protocol," Linda snapped. "Administering medication without a doctor's order. Do you have any idea what could have happened?" "I know exactly what would have happened," Emma shot back. "He would have died. And I'm not in the business of watching people die when I can save them." Linda's face hardened. "I have no choice. You're fired." The words hit like a slap. Fired? For saving someone? Emma felt her breath catch, but she lifted her chin. If doing the right thing cost her job, so be it. As she stepped out, she saw James sitting up in his bed, looking stronger already. His tired eyes met hers, and he raised a shaky salute. "Thank you, ma'am," he whispered. That was enough. But then, just as she turned to leave, another voice rang out in the hallway. "What the hell is going on here?" Emma spun around. A tall man in a dark suit strode in, his presence commanding the room. Dr. William Hayes, the hospital's director. "I just heard a nurse saved a veteran's life and got fired for it. That true?" he asked. Linda stepped forward, flustered. "Dr. Hayes, she broke protocol." "She followed her training," he interrupted. Then, he turned to Emma. "I reviewed the security footage. You acted quickly, correctly, and with a level of care this hospital should be proud of." Emma blinked, unsure what to say. Dr. Hayes folded his arms. "Ms. Reynolds, you're the one who's fired." Linda's mouth fell open. Dr. Hayes turned back to Emma. "As for you, Nurse Carter, I'd like to offer you a promotion. We need more people like you here." Tears burned in Emma's eyes. She had nearly lost everything for doing what was right, but in the end, it was doing the right thing that saved her. As she returned to James's bedside, he chuckled weakly. "Well, guess we both got another chance today, huh?" Emma smiled. "Yes, sir. We sure did. And for the first time in a long time, she knew, she was exactly where she was meant to be. Moral of the story. Doing what's right isn't always easy, but it's always worth it. In a world of rules and red tape, compassion should always come first.